Welcome back. It's Women's Wednesday, and that means we're talking about beauty. And for us women out there, one of the first things to go, I hate to say it, but the eyes. Even mine, I've noticed mine getting a little bit droopy in my 30s. I don't know what happened. My 20s, they were perky. My 30s, a little bit down. Dr. Daniel Rousso is here with us this morning. Thanks for joining us.
Well, thanks for having me. Yeah.
Why is that the first thing on women that goes?
Well, I think that it depends to some degree on their basic hereditary tendency. Some people just have a tendency to have some heaviness to the eyelids even when they're young, and as we get older the tissues begin to sag. We all have fat around our eyes to cushion the eyeball, and that's normal, but as time goes on that fat will begin to bulge and protrude, and we'll start to see some puffiness either under the eyes or some heaviness over the eyes that tends to make us look a little bit more tired, and that's one of the things that begins to be noticed in the aging process by a lot of people.
Well, you know, and it's interesting to me, it's not just women that have their eyes done. A lot of men are turning to getting, especially under here with all the crow's feet.
It's certainly not just for women, and again, this is one of the things that makes us look a little tired, and the surgery that we do for this is very, very easy for most patients. It's probably one of the simplest things that patients can recover from, so much so that a lot of times patients don't even feel like they've had anything done the day after they've had this surgery done. So it's very, very little downtime, very little discomfort with this, so they can snap back very quickly. And so we do a considerable number of men as well that have this. Now sometimes they have enough heaviness that truly it hangs over as time goes on, and it begins to obstruct their vision, and it becomes a functional matter, and those are patients that truly can be improved and have a better peripheral vision by removing some of that extra skin, that hooding effect, and that's where insurance can get involved. Majority of the cases that we do are probably cosmetic in nature to help just the way they look, but some patients definitely will see some improvement in their function of their eye vision as well.
Well, it's interesting because I'm at the gym and I hear a lot of the older ladies at the gym talk about that hooding that you mentioned, and they say, wait till you get to be my age, honey, you can't even put eyeshadow on because you have so much skin up here. And I think to myself, I never thought about that, because women, we do put eyeshadow on, and besides our lips, that's where a lot of our makeup goes. So it's important for us to at least have eyes that we like.
Well, I think that the makeup is certainly one issue, and a lot of women will use makeup to try and create that fold, that crease, to make them look like they've got a little bit more open eye, and of course that's where the incision is when we do the surgery. It's right in that upper eyelid crease, and so it's hidden, so you don't see that little incision when we do this. But the eyelid surgery certainly is one component of it. Sometimes the patients need to have the brows elevated as well, and that's another issue that combines with the eyelid surgery to give an overall more refreshed and less tired look.
Well, I love the fact that there isn't a lot of downtime, because for the most part, you don't want to have everybody in your office know that you maybe had your eyes done, so it's nice they can come to you. We can all come to you if we need it and get a little repair, and it doesn't have to be so noticeable to everybody but maybe ourselves. And
again, the downtime is minimal. Typically within about 7 to 8 days, patients can put makeup back on again. All the stitches are out certainly by the end of a week, and usually less than that.
Okay. Well, you know what they say, windows are the eye to the soul. So if you want your eyes or your soul looking brighter, you can go see Dr. Daniel Rousso at Rousso Facial Plastic Surgery Clinic. And we thank you for your time this morning.
Well, thank you again, Nicole.
I'll be there in a few years. We're going to take a quick break. We'll be right back.